could be us. So back to what I was saying. Could be us.
Hello everyone, this is Danish Riaz from ZMeds with my new video about anti-diarrheal drugs. First of all, we should know about diarrhea. Diarrhea is the too frequent, often too precipitated passage of poorly formed stools. Or we can say 3 or more loosely watery stools in a 24-hour period is called diarrhea. So moving towards the factors, major factors of diarrhea including increased motility of gastrointestinal tract and decreased absorption of fluids. And anti-diarrheal drugs, there are basically 3 classes of anti-diarrheal drugs: anti-motility agents, adsorbents, and the agents that modify fluid and electrolyte transport. Now let's start our first class of anti-diarrheal drugs, which is anti-motility agents. These drugs decrease the motility of intestine by blocking the acetylcholine release, and they are presynaptic opioid receptor activators in the enteric nervous system to inhibit ACH release and decrease peristalsis. As the motility will decrease in the intestine, it causes extended stay of inside the intestine and water will be reabsorbed from the watery stools. Now let's discuss the mode of action of anti-motility agents. Let's draw a synapse. This is a synapse. This is the presynaptic membrane and postsynaptic, and space between them is synaptic cleft. This is the ACH in the seminal vesicle, and calcium channels are also present. When stimulus comes, calcium channels will open and cause the release of ACH into the synaptic cleft, and ACH will show its function. ACH will release in the synaptic cleft. It will bind with the receptors in postsynaptic membrane, and then it shows its function. It causes contraction of the muscles in the enteric system and causes the motility. And when we take an opioid drug like anti-motility agents, it blocks the calcium channels. Here it binds with the opioid receptors and it blocks the calcium channels, and when stimulus come, acetylcholine cannot be released in the synaptic cleft, so it cannot reach the postsynaptic membrane, which decreases the motility of the intestine. Water will be reabsorbed from the watery stools, which can cure diarrhea. Drugs included in anti-motility agents, which are loperamide and diphenogylate. Loperamide is usually more effective because it has less effect on the brain because it cannot cross the blood-brain barrier easily, while diphenogylate is CNS depressant because it can easily cross blood-brain barrier. Side effects of this class including drowsiness, abdominal cramping, and dizziness. Now, contraindications of anti-motility agents, including these drugs should not be used in young children because it can cause megacolon, means increase in the size of colon, and should not be used in the patients of severe colitis. Now moving forward to our second class of anti-diarrheal drugs, which is adsorbents. These drugs act by adsorbing the intestinal toxins or microorganisms and by protecting or coating the intestinal mucosa. It also included 2 drugs, which are aluminium hydroxide and methyl cellulose. Now we will discuss the third and last class of anti-diarrheal drugs, which is agents that modify fluid and electrolyte transport. These agents act by coating of intestinal mucosa, and they also decrease the fluid secretion in the bowel. It only includes 1 drug, which is bismuth subsalicylate. Bismuth has antimicrobial activity, while subsalicylate has anti-secretory activity. Here you can see this intestine, and this is the coating of bismuth subsalicylate. Side effects of this class including black tongue and black stools. Thanks for watching this video. If you really like this video, please subscribe the channel.
We're beautiful.